and welcome to The Virus. I'm Jeremy Fernandez. Coming up, what is monkeypox? You might have heard a bit about the virus recently, but how concerned should you be? We'll ask an expert later in the program. But first, we're being warned to expect one of the worst flu seasons in years, prompting some state governments to offer free vaccines to try to curb the outbreak. Dr. Norman Swan joins us now. Norman, why is it that this flu season is worse than previous ones?
A couple of main reasons. One is we've got low levels of immunity because we haven't had much flu over the last 2 years. I think if you go back to 2019, there were maybe 300,000 cases. It was a big year, 2019, for influenza. But 2020, 2021, you could number it in the hundreds, and I don't think there were any deaths. And we didn't get immunised to the extent that we normally do in a flu season. So we're under-immunised and we've been underexposed. So that's a big reason. And we've opened the borders. Flu doesn't just come from the ground, it comes from overseas. And so people are coming into the country with influenza and it's spreading throughout the community. So those are the two reasons. And then the third reason is the virus itself, of course, that flu is a very infectious virus. And some years you have more infectious viruses than others.
So there's this big vaccination drive on right now, some states offering free vaccines. How much will that go to intercepting these warnings and the prospects of this being a particularly bad flu season?
What the influenza vaccine does, and we're talking on the virus, we've been talking about vaccines for 2 years, but what this vaccine does is it doesn't stop infection, it stops you getting seriously ill from the infection. And let me tell you, people are getting seriously ill from this infection, and the number of hospitalizations is growing. I was just talking to a senior pediatrician at a major children's hospital, and she is seeing very sick children, some of whom are in the ICU as a result of influenza. This is a serious disease in children, and most of the reports, the majority of the reports, are actually in younger people, particularly in the 9 to 15-year age group. So it's a 5 to 15 age group, so it's 5 years and above, but there's also under 5 is a problem too. So this is something that parents need to take account of, and children need to be immunised as well as everybody else. The
vaccines are modified from year to year to cope with different strains of the virus. How well served are we with what's available to us right now?
It's pretty good at the moment. There are 3 main viruses circulating. 2 are influenza A type, which tends to be the type that you get in pandemics, but it's also common seasonal virus as well, H3N1 and H1N1, although they have subtypes. And the other one is an influenza B. So that's not well covered, but it's only 1 or 2% of the cases. About 98% of the cases, at least as measured by the surveillance system, look as if they're a pretty good match with the vaccine. So if you get vaccinated, you're liable to get a bullseye with the influenza that you get infected with.
Speaking of vaccines, the eligibility for a 4th dose for COVID was expanded this week by the federal government. Who should be considering getting that 4th dose?
Well, I think it's been expanded into people who are more vulnerable, immunosuppressed and so on, and rather than just putting an age limit on it. And this is a good idea because the vaccine, the 3rd dose, is already waning in several groups of people, and you're going to find that the level of protection you've got with the 3rd dose is going to go down, particularly in vulnerable individuals who are more vulnerable to serious disease. So it's a really good idea. I suspect as the year goes on, the 4th dose will become more and more available to other groups in the community. The Israelis, when they were testing the 4th dose, they didn't see a lot of value under 60, but it clearly does have value in people who are vulnerable.
COVID is obviously still an issue. I mean, we're seeing some quite extraordinary death rates from day to day, so it's obviously still a significant issue in the health system, isn't it?
Yeah, and the unanswered question is the extent to which we're effectively getting antiviral medications out, particularly into residential aged care. When you look at the age split of people who are dying, it's certainly people aged over 80 is the largest group, but it's also younger people than that. And for the people who qualify for antivirals, they really should get them in the first 5 days of becoming symptomatic. And that really should be intensively focused on residential aged care, the elderly at home, and those who are vulnerable. And if we could do that, we would probably reduce the death rate quite dramatically.
Norman Swan, thank you.
You're welcome.
So what impact is the convergence of COVID and the flu season having on the healthcare system? Tom Simonson is the CEO of the Victorian Healthcare Association, which is the state's peak body for public hospitals. Tom, are you seeing evidence of that convergence taking place right now in the healthcare system?
Oh, absolutely. We've got, in some ways, the worst situation that we've had at any time during the pandemic, because as well as, obviously, an increasingly bad flu season, we've still got very high numbers of COVID cases in the community. We've got, in Victoria alone today, 570 people with COVID in hospital. That's about the number of beds that would be in a single large metro hospital, just with COVID. We've also got people coming back to receive the care that they haven't been able to get effectively over the last 2 years. So we're absolutely in a perfect storm right at the moment. And we're only just starting to head into winter, so it's going to get worse.
And are there particular points of the health system that are especially under pressure?
Well, the whole health system, to be honest, is under more pressure than it's really ever been under before. But our emergency departments, our ambulance services are under particular strain. And what we're seeing is people are having to wait longer than we are comfortable with them having to wait. And it's absolutely, it's an order of magnitude worse than it was pre-COVID. Even though we had workforce shortages pre-COVID and we had issues with funding pre-COVID, it was nothing as significant as what we're seeing today.
We've talked a lot in the last couple of years about this idea of the curve. Do you foresee when the peak might be?
It's really hard to predict. And not to mention, if you remember in mid-December, we were thinking that COVID was kind of over, and then we had Omicron. So there is always the chance that there will be other variants. So we really cannot plan for the future in any particularly effective way, because this virus remains so unpredictable, as does the flu, to be honest. And on top of that, we've got so many people coming to our hospitals for non-COVID or non-flu related issues, and they're much sicker than they were before COVID because we haven't been able to care for them adequately over the last 2 years because of lockdowns and the presence of virus in the community.
Knowing that there are so many things that cannot be controlled, what can people do to avoid being caught in that situation where you're having to go to hospital, having to lean on the healthcare system where it might have been preventable?
Well, we would still say, even though, to many in the community, it really feels like COVID is a thing of the past, do the things that we all learned to do throughout COVID. Try and socially distance where it's possible. Try not to be surrounded by people who are potentially at greater risk than you of catching COVID or the flu and having bad outcomes. Make sure that you're up to date with your vaccinations. We still don't have a high enough rate of third dose vaccinations in our community, or flu. And the other thing I would say is we've still got too many people who are ringing 000 when their issue is not an emergency. We've still got people ringing up. It may sound ridiculous, ringing up and asking very basic questions about where they can get a vaccination, when that line should be kept for people who really need an ambulance to come out and take them to a hospital. So people need to do the right thing. We also need to be patient with our healthcare workers and our healthcare system. We are doing everything we possibly can to keep people safe and well, but we can only do so much.
We know that there have been a couple of other issues putting pressure on the workforce in the healthcare system too. People being furloughed because of illness. There's, the intake of healthcare workers from overseas, which Australia normally relies on quite heavily, is not quite there at the numbers yet. Can you describe for me what the status of that workforce is right now?
Well, we've got a couple of thousand people every day who are furloughed, and this is just in Victoria. So across the country, the numbers are far higher. So a couple of thousand people with COVID who can't work. We've got thousands of vacancies, particularly in our nursing workforce, but also with midwives, allied health professionals, clinicians of all kinds. And it's taking far too long for visas to be processed. So we're seeing international recruitment still not returning to the levels that it was pre-COVID, and certainly not to the levels that we need it to be. And healthcare workers do not grow on trees. So it takes time to train them. We need to ramp up our training, but it's going to take time. So it's a really tough time to be working in healthcare. People are exhausted. We've got people bringing forward retirement, people changing careers, and you really can't blame them after what they've been through. So we need to do everything we can to protect that precious resource of our healthcare workforce.
Tom Simonson, great to have you on the program. Thank you.
Thanks.
So another virus that's been making headlines in recent weeks is monkeypox. There have been a couple of cases recorded in Australia and more than 100 suspected cases outside Africa since the start of May. Raina McIntyre is a professor of global biosecurity and she's also on the World Health Organisation's expert advisory group on monkeypox. Professor McIntyre, welcome to the program.
Good afternoon.
There appears to have been a change in the virus's behaviour. How worried should we be about monkeypox?
Well, I don't think we need to be panicking at this point, but it is quite concerning that it has spread so widely within Europe initially. It seems like the cases that have occurred in multiple countries in Europe, North America, Australia and so on have originated from the UK probably, as well as some super spreading events in Spain particularly. And that's the first time really since monkeypox was first known to infect humans, which was in 1970, that we've seen travel-related spread from outside of the African continent. And of course, there seems to be substantial human-to-human transmission occurring in those outbreaks.
Is it clear why that's happening now?
No, it's not. There's some speculation in the UK that it might have been circulating undetected for the last few years. There was the first imported cases into the UK occurred in 2018 and again in 2019. It's also been spreading largely, but not exclusively, in communities of men who have sex with men. So whether there's also been speculation as to whether it's sexual transmission, although when you've got really close contact in intimate contacts, it's hard to say which specific transmission it is.
So monkeypox is not described as an STD, but to what extent can we think about it in those terms?
No, it's never been described as an STD. In the normal clinical presentation of monkeypox, most people will get a rash on the face, followed by the next most frequent site is the palms of the hands and the soles of the feet, but about 30% of people get a genital rash. But the other thing is it's not as well studied as some other diseases because it's been a relatively infrequent disease, and it's only really started causing big outbreaks since 2017.
Are there particular communities that are more vulnerable than others? You mentioned the queer community, where the CDC in the US has certainly put out a warning saying that people in the LGBTQI+ community are at a somewhat elevated risk.
Yeah, I mean, that's where it's spreading. Most of the cases there's a male predominance in the cases, and a majority of cases have been linked to either particular super spreading events and have been in men who have sex with men. So I guess, being on and several patients have presented to sexual health clinics. So I guess it's really important that there's awareness that monkeypox is around.
What are the key symptoms that people should look out for?
So it starts with malaise and fever, swollen lymph nodes, and then the rash appears after that. So the rash can start in the mouth, so it may not be noticed. And then when it appears on the skin, obviously it's noticed.
When monkeypox first popped up in the news not long ago, I know a lot of us kind of took a deep breath and thought, gosh, not another one. What is your message for people who might be concerned about this, particularly considering all we've dealt with in the last couple of years with COVID?
So monkeypox is not very contagious between people. So and we don't expect that there's substantial asymptomatic transmission. So those are two areas in which it differs from SARS-CoV-2, for which there is substantial asymptomatic transmission and it is easily spread between people. So monkeypox is much less contagious, much less, I'd be very surprised if it takes off in the same way that SARS-CoV-2 did. So it should be easily controlled with vaccines and easily treated with antivirals. The way to use vaccines, though, in this case is to contact trace and vaccinate the contacts. That's called ring vaccination. and it's a strategy that was used to eradicate smallpox from the world.
Professor Raina McIntyre, great to have you on the program. Thank you so much.
It's a pleasure.
And that is the show for this week. Thanks for your company. Bye for now.